everyone. Imagine being an Aztec running through the jungle. You cut your foot up on a sharp rock, and the doctor to prescribe azithromycin or azithromycin to be made to give or be prescribed. This is a situation that many faced before pharmaceuticals became or were around and introduced. The only source available to treat a wound or infections was herbal medicine. So herbal medicine has set the foundation that allowed pharmaceuticals to come as far as they have. Herbal medicine is still used now in modern age and mainly used by holistic medical doctors. Herbal medicine Herbal medicine is defined by Merriam-Webster as the art of practice of using herbs and herbal preparations to maintain health and to prevent and alleviate or cure disease. Herbal medicine is easily accessible. It does not require a prescription or a visit to the doctor's office. It's affordable. You can grow it in your backyard at no cost to you. And although it's easily accessible, if used improperly, it can become poisonous. So you need to be careful. Herbal medicine has now replaced anti-epileptic drugs that can become toxic to the liver, very well known. Epilepsy is also defined by the Mayo Clinic as a central nervous system neurological disorder in which brain activity becomes abnormal, causes seizures, periods of unusual behavior, sensations, and sometimes loss of awareness. According to Sucher, Nicholas, and Mary Carles, Pharmacological Basis of Herbal Medicines in Epilepsy, that was published June 12, 2015. Extracts of hundreds of plants have shown to exhibit anticonvulsant activity. Synthetic screens performed in experimental animals. For example, medicinal marijuana and CBD has been used as an herbal alternative to pharmacological medication for dogs. For example, my dog Marley was diagnosed with epilepsy when he was a puppy. The medication that was prescribed to him was pretty expensive. It was roughly around $135 per refill. When that was deemed ineffective, when that stopped working, they did do monthly shots. Each shot was around $78. If that one didn't work, then we'd have to come back and give him another injection. The treatment was causing his liver to reach toxicity levels and secrete too much. The cost was very expensive and the side effects could be deadly, so I expressed to the veterinarian that I wanted to maybe go a holistic path or if there was any other options. So he had suggested starting Marley on CBD and transferring over to that tincture. His seizures were reduced from every other day to once every 2 months. The cost of the tincture is about $37 to $38 and it lasts for 3 months. Although this treatment was successful, too much CBD could cause lethargy, diarrhea, and heavy vomiting, especially in dogs. In Marley, that's what it was. So today I want to just discuss the risks and the benefits of herbal medicinal medications in regards to epilepsy, in respects to epilepsy. By the end of the speech, you will have enough information to make an informative decision if herbal medicine is an option for you or for your pet. Okay, first we will discuss the benefits of herbal medicine for epilepsy. An herbal medicine used for epilepsy that was shown great promise is cannabis sativa. According to Dr. Emily and Yuma Wu from U.S. Pharmacist, cannabis sativa and cannabis indica are two species of the cannabis genus of flowering plants, both that have been found to be successful. There are many strains of cannabis that can prove successful to treat epilepsy. These were two that did show big promise. According to Daniel Dredson of Medical News Today, interest in the use of medical marijuana is particularly strong for roughly 1 million U.S. residents whose seizures are not controlled by AEDs, which is the anti-epileptic drug. Some families with young children suffering from severe seizures have moved to one of the 22 states that have now have medical marijuana use. Many families have found promise in medical marijuana as a substitute for anti-epileptic drugs. Other herbal medications that could be used to ease seizures is CBD. CBD is short for cannabidiol. The CBD contains no THC, so it cannot give you the sensations of the regular marijuana. CBD and medical marijuana are more affordable than pharmaceutical drugs as Keppra that are used for anti-epileptic disorders or anti-epileptic medications. So in order to understand the benefits better, we also must understand the risks of herbal medicine for epilepsy. Many herbs could possibly induce additional seizures. According to Wiley Online Library, the most famous example of this would be Vincent van Gogh, who during the last 2 years of his life suffered from hallucinatory convulsions, which is another word for seizures. Many believe that the reason for his seizures were because he had reached toxic levels of wormwood. Van Gogh suffered from these adverse effects caused by the natural herb. They were causing him to have more seizures instead of helping him. So too much medical marijuana is another thing. They could cause increased sleepiness, can affect the motor skills, cause you to be able to complete your daily tasks, reduces your respiration rate, and makes your tasks every day become a little more dangerous. And it can actually increase your heart rate, causing you and can put you at risk for a heart attack. So taking the wrong milligram dosage of CBD, as we've said, can increase nausea, vomiting, diarrhea, drowsiness, and all other side effects. Can cause serious secondary illnesses as dehydration. And as many of you know, dehydration can actually lead to death. So it could be very deadly. So although there's many epileptics converting from Keppra, as you know, well-known anti-epileptic drug, there aren't sufficient enough studies to show that CBD and marijuana are proving herbal medicine is effective choice of treatment for epilepsy. So now that we have discussed the risks and the benefits of herbal medicine and epilepsy, we discussed how herbal medicine is cost effective compared to prescribed pharmaceuticals. We also discussed how, although more affordable herbal medication could possibly, it can increase seizures and cause unwanted effects. Taking a closer look, herbal medications have been around for centuries. They are great, but although effective although effective for many with epilepsy, herbal medicine is not an effective for everybody. It's not effective for everyone with seizures. Those that may see great results and reduce their seizures, there's other 50% that just won't. So